All right. I think we'll wait for a couple more attendees to join. Thank you, everyone, for logging on today. Got some participants jumping in. James, while we're waiting for people to hop in, what's the weather like there? I know it's absolutely horrible in Cincinnati right now.
Also in the Midwest, so here in Chicago, I think we're at a very balmy 93 today.
Yeah, it's been fun. I walk outside and I feel like I'm swimming in a pool. It's disgusting. So hopefully everyone's inside and AC's running.
Yes, and describe my office as a sauna to some.
That's too funny. All right. Well, we are right at 2:01, so we'll go ahead and get started. Thank you again for joining us today, everybody. And James, thank you. We are excited to talk about all things healthcare. Today's webinar will be recorded. We'll send out a follow-up, so you will have access to that recording. Share it with your friends. I know they're dying to see this content. And most importantly, don't be shy. Ask questions. James and I both really like to be engaging with, commentary from the side, questions you guys might have. So please do not be shy and feel free to use the Q&A option and send those across. If we don't get to some of your answers, I know at the end we will have an open discussion Q&A session, but send those throughout the webinar. If we don't get to your answer live, we will make sure that we follow up with you guys independently. So with that, I will go ahead and get started. So who are we? My name is Maddy Rieman. I am head of customer success at Cerkl. We are working with thousands of internal communicators and HR teams globally in all different industries. We have a software solution that is assisting in the internal communications and HR space, allowing for communicators to enhance their overall engagement with employees. One of our largest client segments, is the healthcare industry, hence why we are partnering with Jarrard today to discuss some of the trends that we're seeing. So James, I'll pass it over to you to introduce yourself.
Thanks, Maddy. It's a pleasure for being with you this afternoon. Thanks for having us. Uh, my name is James Cervantes. I am a leader within Jarrard. And for those of you who don't know Jarrard, we are a strategic communications firm that partners with healthcare organizations across the country during times of change, challenge, and opportunity. I lead our regional health system practice and have more than 10 years of experience working closely with marketing, communications, and other health system executives on large-scale change, transformation, including finding ways to communicate across an organization. So when Maddy approached us in Cerkl and said, we have an opportunity to really share some key insights about ways that we're seeing healthcare organizations more effectively communicate and connect with their organization, it was a no-brainer that we would share this content with you all today. So thank you for joining us. Thank you for carving out some of your time on we know is a busy week. We're excited to explore some of these themes with you today. So with that, we'll jump in.
Absolutely. So what are we talking about today?
So here's what we have in store for the hour. First, we want to set the table and reflect on the current environment that we're in and what we're seeing across the landscape of communications and healthcare specifically. Second, we want to share how we think about audience segmentation and what we're seeing certain audiences value most right now. Third, we believe strongly that communications is bidirectional, but what does that mean exactly, and how do we achieve that in the environment that we're in today? Fourth, knowing how much of a focus right now there is from healthcare organizations to prioritize their people, we want to talk about how communications can unlock the belonging, inclusivity, and connection that so many of us strive for and so many of us crave in our work today. And then lastly, we'll conclude with where we think communications is going, what's around the corner, so we as leaders can be better prepared to meet those moments. We'll make sure that we leave enough time for any questions and discussions at the end, but as Maddy said, please do drop them in the chat or push a button to make sure that we get your question or get any comments from you as we move through the conversation.
Absolutely. Let's talk about objectives. What do we got here, James?
Okay, we hope by the end of the hour you walk away with really three things. What's contributing to the gaps in communications today and engagement, and importantly, how to solve for them. How to better understand and therefore connect with the audiences that you have in your organizations. And then specifically, what are some tactics for leveraging communications to build the elusive trust and belonging that I mentioned before that we all desire. So with that, I think we're going to dive in. So let's set the table a little bit on the current state of healthcare communications. If we go to the next slide, it's certainly an interesting time in healthcare right now. I know all of you see this and read about it every day. For hospitals and healthcare organizations, externally, we're seeing increasing pressure from regulatory agencies, media, communities, challenging merger and acquisition deals, challenging hospitals and healthcare organizations' nonprofit status, community benefit programs. It seems like the attacks are coming from all directions daily. Internally, we're seeing an entirely new generation, Generation Z, enter the workforce. We're seeing millennials move into manager and leadership roles for the first time. Baby boomers fighting for their place among the ranks in leadership and trying to figure out what their role is in these emerging, growing organizations. This is all coupled with an increasing shortage of healthcare workers. You all know this. I think the most recent study I read was that from the US Bureau of Labor, they're saying that upwards of 275 to 300,000 additional nurses are needed from 2020 to 2023. It seems like we moved through the pandemic with the travel nurses, but we still have major shortages in some of our key employee groups across our healthcare organizations. Not to mention the other environmental challenges that we all face and sort of hear about in the news, the cyber threats, the AI revolution, burnout. While none of these individually are necessarily new threats, right? For those that have been in the industry, these aren't necessarily new, they're familiar. Together, combined, however, they do pose significant challenges on healthcare organizations, which is leading to a greater demand for communications and connectivity, and really a call for us to be more efficient and more effective than ever before in how we communicate. So we're going to explore some of these trends a bit more to understand how they impact and ultimately how we can solve for them in healthcare. So here are the key trends that we're seeing today. There are really four that we want to focus on for the conversation. One, as I mentioned, around people, workforce growth and engagement. One around this digital transformation and what I would call growth. Third, around modernizing our internal communications channels and developing a more sophisticated infrastructure to do so. And then really to make sure that we always keep in mind sort of this notion of cybersecurity and privacy. So we're going to unpack each of these in a bit more detail.
Awesome.
So workforce. It's not a surprise that, when we ask leaders what their number one priority is in 2024 at Jarrard, most say workforce is the thing that keeps them up at night. After all, this is an industry that revolves around people taking care of people. So it's not necessarily a surprise that our people should be a priority. Why this matters today, however, is that there's more turnover than ever before. The average is around 20%, though it varies by employee group, and not to mention a significant focus, and rightly so, around mental health and total well-being. We're seeing more changes to total well-being programs than ever before because employees are demanding more from their organizations. And we know people in culture and HR departments simply need to be more competitive in the market to be able to attract the talent to their organizations. Given the market, we all know that it's highly competitive. Recruiting is key. So therefore, understanding that communications doesn't just start when a new employee begins your organization, but really from the moment they see the ad and apply, that moment when the recruiting really begins. So we're seeing a concerted focus on not just internal communications, but also the entire recruiting and onboarding journey and what that looks like, and making sure that they're getting the unique experience from beginning to end. The second,
I'll add there
yeah, go
real
ahead.
quick. On that note, we are seeing from the Cerkl perspective an increase in conversations with existing customers about how they can leverage specific tools to ensure that the communication for people who are just applying or potentially interested in working at their organization, it's starting even before day one when they check that clock in button. So I think this is a really good call out to see the stats of that, because we're feeling that those conversations increase significantly at Cerkl too, which is powerful.
Right. Along those lines, in a largely remote workforce, there is an even greater need for connection and collaboration, right? So a lot of us during COVID, moved our teams to remote, which is, I think, a good thing because, most sort of younger generations appreciate that. However, we're seeing some disconnect with teams and with communications teams, and even the way that we communicate with people. So what we're seeing at Jarrard is really an emerging best practice, and it's emphasizing sort of this notion of creating in-person moments that matter, right? Retreats, workshops, in-person development sessions, strategic brainstorms, or just bringing people together to make them feel heard, to make them feel special, foster opportunities for shared learning and understanding and collaboration. So there is a world where we can, maintain a partly remote workforce, but still have sort of those moments of connection and collaboration. Um, so there, it's a balance, and we're seeing some interesting trends there. Anything to add
Absolutely.
on those lines, Manny?
Yeah, I think just coming off of a world of post-COVID, which I know everyone's tired of, especially in healthcare, of hearing that, but there is that real sense of burnout. You guys were affected um, most clearly in those however many years, and finding that new normal, right? Being able to say, how can we ensure that we're keeping our workforce strong, informed, engaged, in this new world where people are starting to want to collaborate, be in person, whiteboarding sessions, all those things that you mentioned, James. So increasing all the methods in which you are working towards those things is imperative at this point. Awesome. So let's continue on here, James. I think you're going to talk a little bit about digital transformation and cybersecurity, those last two from the trends we're talking about.
Absolutely. So we know that we're in this, we're living this together, right? We're in this digital transformation. Communication is a key part of this. It's becoming our new normal. And so while we're still trying to figure out its role in society and in healthcare specifically, the role that digital has, and even specifically AI, we know employees, patients, leaders are asking about AI specifically and how we can use it to our advantage safely. So being able to try, test, pilot specific programs to see what resonates, to see what is advantageous to your culture, I think is a smart way to approach it. But we want to do so sort of within the safety guidelines of making sure that we're not violating any privacy or jeopardizing our healthcare organization. Along those lines, threats of cyber attacks are also now part of our daily lives, unfortunately. And so needing to be able to communicate with employees and patients in real time up to the minute is almost the new expectation. It's email, yes, but at their fingertips is more important as we think about all the threats that really loom large that our healthcare organizations face on a daily basis. So all of these things, I think coupled with increasing financial pressures, smaller operating margins, post-pandemic organizational restructures, strategy relaunches is really causing this storm of sorts inside many of our healthcare organizations, which, from our perspective, we think is an opportunity. Some may see it as sort of a threat, but it's a time to really look inward and reflect and figure out how are we communicating today with our workforce and our employees, and is that the best way to communicate with them, and what could we be doing in the future to reach them better and to meet their needs. And so that's where we're going to go next. And with that, I'll pass it. I think there's one more slide here. This is interesting. So I think we're in this unique time where we're at a critical point where we have some emerging trends, this move toward digital and AI and new platforms and technologies. But by and large, what we're seeing is, for most healthcare organizations, the primary way that we communicate is still email. It's still intranet. Microsoft Teams is increasing, but we're in this state of transition when it comes to communication. I think that's just important to understand that it's not going to be something that happens overnight, but something that we have to plan for and really think about strategically as we move to the future.
Yeah, and how you connect all these channels together, right? Because email, we've been saying this for a long time. Email is not going anywhere. It's the tool that everybody loves to hate. You need to be able to send those communications via email. It's how people expect it. But with the increase of such a diverse workforce constantly on the go, it's not as easy to always get to your email. How else can they get the communications, the information, things that they need to do their job and want to hear about across these other channels, and making it easy for them, right?
That's right.
Awesome. So let's go ahead and jump into understanding your audience and what they value most. So inherently, there's a difference between what you need to communicate, either from just like a legal perspective or from a business operational perspective, and what your audience values most. It's finding that balance that is key to ensuring that you're putting your audience's interest in what they value most at the forefront. And that will, as you know, increase overall engagement and awareness of what's happening outside of your organization. When we talk about understanding your workforce, making sure that you do have that leadership alignment. And I know, James, before today's webinar, we talked a little bit about ensuring that you are able to align not only the top level leaders, but those people leaders. And some ways that we've seen clients tackle this is making sure that they provide managerial training for groups and people leaders, especially in times of change, right? So you might communicate out that there's an M&A or a merge with another healthcare system or a massive shift within your organization. But how are the people managers supposed to communicate that out? What is the sentiment? What are their talking points that they should also be mimicking? So you're speaking the same language from top all the way down. And then making it human, ensuring that, it's not all this corporate speak. Of course, there's a time and a place for emojis and things of that nature, but we are seeing a massive shift in our internal communication teams, straying away from, hey, this is so rigid, to let me be a little bit more human, and ensuring that there's that aspect of connectivity when there are those moments of change. We also see that you need to listen and understand, right? Communication is not a one-way street. It's a many-way street, and ensuring that you are facilitating and allowing for that within your internal communications, your structure is important. There are things like pulse surveys. I've had a couple customers utilize those types of tools in a really interesting way, and a way that you might not necessarily think of doing out of the box, but thinking about what's happening in your city, your location around you at that time, and capitalizing on that, right? So, we've had some customers around the Super Bowl send out pulse surveys to ask, hey, employees, who do you think is going to win this Super Bowl because their local team was in the Super Bowl that year? So there's some really interesting ways you can make it fun. It doesn't always have to be so rigid, but you can get them to engage in a deeper way. And then, of course, making sure that you have the opportunity to allow them to comment on your internet posts or your content internally. And then any type of social sharing. I know that's something that we're working on at Cerkl as we speak, is allowing for the ability to socially share. How often are people taking the opportunities to outwardly share the important things, the cool things that their organization are doing internally? So being able to highlight, listen, and understand and analyze all those things are crucial. Ensuring that two-way communication is happening, but what do the metrics say behind it, right? You can all day long listen, but until you understand and apply those changes, you're going to fall a little bit on deaf ears. And we see that a lot with organizations that are coming to a new tool, trying to understand the metrics. What are people engaging with? How often? Where are they receiving it? Being able to identify those trends within your tools and within your workforce is imperative. So let's talk a little bit about what your audiences value most. So this is a interesting report where we can see the deviation between what leaders and employees value most when it comes to communications. Of course, leaders are going to think foundationally first, overall business strategy, structure, right? But the individual employees think operational first to their needs. What do I need to do to get the job done and hopefully do it well? So these are some individual values when it comes to the content that employees versus leaders are typically prone to providing their audiences. Some things that we're seeing on the Cerkl side is really interesting. Some of them are kind of fun, but we are able to identify key trends in the types of communication that is being delivered to our organizations and to their employees. So being able to dig into those metrics, understanding that recognition and peer awards is something that we see time and time again as one of the most engaged with pieces of content across healthcare organizations. They want to know what's happening, the good things that their peers are doing, and they want to be able to share that externally. Community health and wellness, they want to be tied to their community. It's it's something that isn't lost on all of you, that someone who is working in healthcare, they are pouring their life's work into making the community better. So understanding ways that they can engage with community health and wellness outside of their day to day, any volunteer opportunities, anything's going on down the street, they want to know about those things. And my favorite of all time is the lunch menu. We see that time and time again. People are so interested to hear, hey, what's on the lunch menu for this week? So those are some interesting things. And you can tie other communications to recognition and peer awards. So it's not just a one and done. It's allowing you to combine multiple of these audience values and into one piece of content. You can get a larger audience set of eyes on it. And then from the combating communication overload, we hear this all the time. I've even had a customer come to us saying that they were sending over 50 emails to their employees every single day. It was baffling. And they knew that it was a problem, right? They'd heard this, they felt it, they knew it, but it really stemmed from the fact that they didn't have a way to segment out their audience, right? And legally they had to get this stuff out, but they didn't have a way to effectively group their audiences that needed to know about this specific piece of content or this policy change. So they just had to send it to everybody, right? So being able to identify those segments in your audiences and track those from the system level, understand the data, understand your people data, work with your HR teams to say, hey, what attributes are available and how can we utilize those, whether that's through distribution lists or rule sets. It's imperative to ensure that you're getting the right content to the right person. Otherwise, they're just not going to listen to anything. And then, of course, streamlining communication channels. As we mentioned at the top of the webinar, we're in a day and age where I see something in one platform. Why am I seeing it again in another platform? I've already completed my benefits enrollment for open enrollment. I've already completed the new policy change. So why am I getting it again? That all those things compound on each other and put employees in a position to tune out. And then, of course, the idea of measuring that communication effectiveness. You see a lot of customers coming from just utilizing Outlook where there aren't any metrics. You don't know what's working. So being able to include tools or ways in which you can analyze what is working, how are they engaging with it across the board, it is really important to the future of what you guys are doing. So let's move on, or anything, James, before I just move on to the next item, anything you want to add here from your perspective?
Yeah, I think, what we've seen really this year from clients across the country are really three things when it comes to sort of cutting through the noise of communication. One is really keeping information and communication bite-sized as much as possible. I mean, we're talking one or two sentences at most. And then second, which goes along with that, is really the use of like hyperlinks. So, it's an email, but maybe it's a sentence and it's a hyperlink here, read more here, which is driving them to your intranet page or another site or a newsletter where if they want, they can read more about it, but they don't have to in that moment. And then third, kind of this use of visuals. So whether it's an embedded video or a picture, but something to kind of catch the eye and hold their attention and connect it and create more of a story around it. Those types of communications and moving to using some of those sort of tactics are driving, I think, hope, at least with our clients, higher open rates and greater success with readability. So just wanted to share that.
Yeah, and I'll mention there too, because I think I forgot to cover the advocating for communications alignment. It's really difficult when you have multiple hospitals or locations, or even through mergers and acquisitions to align all those communicators, right? Because at one hospital or location, one division, they might be communicating in their own tool or um, responsible for sending out things that are imperative to that organization. But who collectively is on top of all of that, understanding what is being sent? Because it's not just what you as corporate communicators are sending, it's what else are they getting from their manager, right? From their location, from their divisional departments. So not just looking at it from a perspective of what you're sending, it's what else are they receiving and what do they need to know. So that's where that 50 emails per day number kind of came from, was when that organization took a step back and said holistically, what are we sending how often to our employees? And it's impossible for one person to sift through 50 emails. They wouldn't get any work done, right? They'd just be reading emails all day. So understanding that is important, and aligning your organizational goals, giving the autonomy to the individual divisions, departments, locations to send what they need. But having that streamlined is crucial.
Would totally agree, Maddy. We're doing an audit right now with the health system in the Midwest, and that was the exercise that we recommended and that they asked us to do, was take sort of 3-4 employee groups, from a clinical person to a non-clinical person to a first, third shift, and do a current to future state. Like, what does their current email inbox look like right now? Like, where are all
Crazy.
the emails coming from? And it's mind blowing how many that they're receiving on any given day. And for clinical folks that, to your point earlier, are not sitting at a computer like many of us are, right? So it really is, I think, a fruitful exercise and bears a lot of insight into the reality of your workforce. So couldn't agree more.
Awesome. I think you might have cut out there a little bit, James. But I think we heard the last part of, like, as a clinical worker, you're not sitting at a desk, right? You don't have access to just sit there and read every single email. Is that correct?
Correct. Yes. Sorry about that.
No, no worries. All right. So let's jump into the next topic, the importance of two-way conversation. Pass it over to you.
Thanks, Benny. So we can go to the next slide. At Jarrard, we field a series of surveys throughout the year, with physicians, with nurses, with consumers. And so it's always interesting to us, kind of the information that we get back from these surveys. And I thought this question from our latest National Consumer Survey with physicians was really interesting, as it relates to
Again.
understanding what physicians are wanting in terms of communications engagement from leadership. So you can see some of the open text responses when we ask this question to physicians: what is the number one thing that could help increase your trust in the leaders of your organization? And fully 1/3 of open text responses include the words transparent or transparency, or honest or honesty, which is a really important element of building trust among physicians. So I share that because in the spirit of two-way communications, it's so important that, creating that two-way is really what builds trust. That's the key lever, I think, and many of us at Jarrard feel that that's what really creates that level of connection and trust, that physicians, whoever, nurses, feel like they have a place to share their voice, and that they feel like their voice is heard. So I don't think that can be overstated enough. If we go to the next slide, this was a survey of nurses that we did. And I think two things here that I want to point out. One is what this tells us is who they want to hear from, and what they care most about. So when we think about kind of communications and who the messenger is, and what the content is, I think this survey is really telling, because it tells us that for nurses, which I think would be true for most employee groups, they want to hear from their direct manager, right? That's the relationship that they covet the most. They want to hear from their direct leader about specific changes, particularly to them. You heard that as the key theme that Maddy mentioned in sort of the employees versus leaders. And then second, they really want to hear things that impact them directly, related to their department or practice. While they care about what's happening sort of at the organizational level, it's sort of second and much further down the list. So when we think about your editorial strategy and your content and your customization, think about the employee group and think about what's on top of mind for them, not necessarily what's top of mind for us or what we're trying to push out, right? There's a time and a place for that. But if you're going to kind of create the content, let's figure out what the right order is, because that's ultimately going to lead to what people are going to read and care about most. Next slide.
Right.
Okay, so we mentioned a few times like the bidirectional, the two-way conversation. So what does this really look like in practice? And to me, there's kind of the three tenets to this. One is really creating the space for feedback. So it's not just leaders pushing out content through videos and through emails and through town halls when folks are up on a stage talking at people. It's giving your employees, leaders, your workforce time to engage in dialogue, right? It's creating the space and opportunity for them to ask questions, to participate, to inform certain decisions, even to serve on a focus group, to be a part of a reactor panel. Those are the opportunities, and I think the types of infrastructure that we can create at healthcare organizations that move us closer to this two-way conversation. The second thing is, so they share information, do something with it, right? That's the second sort of key part of this is as leaders, we have an obligation now to take sort of what they tell us, what they share with us, what they ask of us, and then do something with it. Be earnest in our ask for information and let that sort of drive elements of the strategy, or let that influence sort of the timeline or the rollout, or have them serve as a champion or leader in some element of this work. Because they were able to give that input. So it's creating the space and then doing something with it. And then the last thing is tell them that you did something with it, right? It's closing the loop, that loop that we all sort of hear about, but that so often we forget because we get so busy and we just keep moving on to the next thing as leaders, right? So you kind of see this diagram. It's really three things. It's creating the space, creating the opportunity, the environment for that two-way. It's then doing something with that information that they give you, and then it's telling them what you did with that, right? And that is what ultimately that sort of two-way loop conversation looks like, and in our minds ultimately builds that trust, because they know that they now are in an environment where they have a voice, and two, they can give input, and three, that the leaders of their organization value their input and value them as individuals. Anything you would add here, Maddy?
Yeah, I think it's really interesting around the idea of like the transparency, honesty, openness, and ultimately being able to say we hear you, right? We hear a lot of customers, or in general, I know some of those survey results might not be the most exciting thing for you as a communicator to hear about your organization, and to bring that to HR, that hey, people are consistently saying that this piece sucks, or this could be better, or we wish we did this, right? But being able to be open, transparent, honest, and say we hear you, and not necessarily glossing over the fact that there are some negative things that need to be worked on, but being open to say we hear you, we want to make this change. It breaks down a level of a barrier between organizational leadership and the individual employees. So I think that's absolutely important to call out.
Yeah, it's such a great point. It's really balancing it, right? So we want to be transparent with them about some hard choices that we might have to make as an organization, because what we don't want to do is pretend that everything is fine, right? Is
Exactly. Yep.
that the environment that we work in, the environment of healthcare is, everyone has their rose-colored glasses on and we're all going to be great and everything is going well. And then when we have to make a hard decision, it feels like it's coming out of left field and it feels like the earth is ending, right? So it's how do we be honest with our employees about the real hardship that we're facing in certain areas of our business, but then still rewarding and celebrating and acknowledging the good things that are happening, because there are so many of those, right? I think that's what we see sort of even these younger generations looking for. It's just the raw honesty, and just be transparent with us about what's going on, and then we can get on board with you.
Exactly. And you don't feel lied to when something does happen, right? And I think that that sentiment is important to be able to carry through. And might be, as you mentioned, a major shift from like the generational changes that we're seeing. We see that the younger generations don't see their job as transactional. They live and breathe that, especially healthcare, where you have these employees that have spent a significant portion of their life going to school and wanting to give back to their community. It's not just transactional. It's not just clock in, clock out. It means more to them. So I love that. All right. Let's head over to leveraging communications to create engagement, belonging, and connection, which of course we all strive for. When it comes to the importance of belonging, there is a massive increase in overall employee well-being. The data shows that any communicator can see the idea of the potential burnout of their employees. That turnover stat that James mentioned at the top of the webinar is something you can't dismiss, right? So how do you put a focus on your employees' well-being, whatever that may mean to them? So understanding what is most important to your employees, ensuring that they are at the forefront of your communications when it comes to those things, especially when it comes to any opportunities for, let's say, collaboration for your internal employee groups or advocacy, diving into those things from a well-being standpoint. And then organizational loyalty as well. We see that when someone has been at an organization for a long time, they continue to stay engaged. Being able to identify smaller groups of employees that might have started and are disengaged from the beginning does give you the opportunity to dive into that segment of your employee base. What do they need to be successful? How can you make them advocates? And that's going to change from group to group, but diving into the metrics there is something that can help you optimize and reduce that turnover. So the role of communication tools, making sure you're building that community, as we mentioned, social sharing, being able to comment, provide feedback, inclusive communications as well. There are lots of changes in technology itself, but making sure you're keeping top of mind any ways in which you can translate your content. There are tools there that allow for you to automatically translate a message to any given language, right? This is the importance and the cool thing about technology nowadays is those things are at your fingertips. So don't shy away from them. And then strengthening organizational culture. So making sure that you are consistent in your messaging, making sure you're working with your people managers, other leaders outside of C-suite to make sure you have those same sentiments that are being passed down throughout the organization. When we talk about the interactive visual and multimedia content, we hear a lot of people saying, hey, we want to start doing videos. That was huge in COVID. There was an increase in the number of emails that are coming from the C-suite during COVID with a little, iPhone video. It used to be thought of as, video production set is required. We need to spend a lot of money. We need to pour in all of these marketing resources into those types of initiatives, but we've shifted from that. So utilize the tools that are at your fingertips to increase or just test out some of these initiatives. So don't feel like it is as rigid and structured. If you want to try a video, multimedia, any type of content that is a deviation from just the written form, there is increased statistics of people engaging with those types of multimedia content as well, especially generationally. If you're looking at maintaining those regular updates that are relevant to employee audiences, making sure that you understand what channels do they want them in? How do we ensure that we are getting the content to employees when and where they prefer, especially on the go? As James mentioned before, a lot of your employees don't sit at their desk. They don't have their email opened every single day, or they're sharing a computer, right, on the nurse's floor. So making sure you understand, how can we get you this content? How can it be searchable for you so you can easily access it in the future as well? Anything else you'd add here, James?
I'm seeing a couple of questions.
Oh, yeah.
So let me take a pass at answering some of these because I think they
Sure.
relate to what you're talking about here, Maddy. So there was one question around, would love to understand more about email open rate standards, given the channels are evolving and emails may or may not be a preferred channel in a bite-sized content world. I think it's a great question, great point. So as we think, and it relates to the other question that someone posted too around how do we reach employees that aren't at their desk and aren't checking their emails throughout the day? How can I ensure they see important communication? So I think, although not directly stated in a way per se, I think Maddy and I, feel strongly that it's sort of a multi-channel communications strategy is what's best. Email is still sort of the top of that list, but it can't be the only thing at that list on that list, right? It needs to be several different sort of approaches that you're taking to reach your employees. A couple of specific things that I've seen really effective at healthcare organizations for those who aren't at a desk is, a lot of in clinical areas, they have bulletin boards. And so they literally will print out sort of the weekly update from the leader and put it on the bulletin board and do that every week. For some areas like environmental services, they create sort of a binder that they leave on a desk where they literally print out some key communications from system areas like HR, IT, and sort of the C-suite so that they can flip through that when they're on their break and sitting and having lunch. So, like I said, we're kind of in this transition state where, yes, we're seeing new technology, but some tried and true communications like printing and bulletin boards still very much work in a healthcare environment because of the way that so many of our employees sort of spend their time in work. Going back to the first question related to bite-sized content, it's still really difficult to get to like the 90% open rate, right? We've yet to really see that consistently. I think 2/3 is still like, kind of the leading benchmark. In the example that I mentioned earlier, when we saw there was one leader who would send a weekly update and it was literally 3 pages long. It was long form, all really great things to share, but people just weren't reading it. And when we moved it to literally a 1-page email with a couple headlines, bullets, some hyperlinks, some pictures, the open rate went up like 15 percentage points. So it's very possible to move that needle by simply making some small changes in the way that it's structured. We're not talking about drastic changes to content per se, but some small structural changes can really lead to an improved open rate for others. Anything to add?
Yeah, I think it's interesting when we talk about open rate, right? And all these omni-channel experiences now. When you think about it, you can't just think about your open rate because that doesn't give you the full picture anymore. Understanding, hey, what is our open rate? Sure, but what amount of our content is being digested in Teams or on a mobile app? Well, what I'll say there, or in SharePoint, your intranet, you can't necessarily expect one channel to be a one size fits all. Just like we can't expect 90%, 100% open rates, we shouldn't expect a mobile application that's being rolled out for your organization to have 100% adoption. It's impossible. How we should be looking at that is these channels are all additive to each other. So if you have a 65% open rate via email, fantastic. And then you have a 10 or 15% engagement on Teams or in SharePoint, that's also fantastic. That's additive on top of your email open rate. Being able to look at those metrics holistically and the systems as a group and not just one channel and defining that as communicational success will help you better understand how you can shift your strategies moving forward as well.
The question around, how do I ensure they see the important information? There's, I think, again, not a one size fits all, but I think that's where Maddy was really talking about the role of the manager and leader, right? And the expectation that we're setting with them to make sure that, yes, we're sending information, we're pushing it down, but it's also the responsibility of that manager or leader to follow up with employees. And what we've seen is those team huddles, those safety huddles, those quick 10-minute meetings in the morning or at lunch are when people are most engaged. So ask your manager to ask the question like, hey, did you see the email from our CEO about X, Y, and Z, right? any questions. It takes 2 seconds and it doesn't have to take up your entire team huddle. So although it's harder to measure, I think setting the expectation about what the role is for your managers and leaders in communicating important system information, I think is really important.
Yeah, I know that's something I do internally for my own team. Every week in our weekly meeting, I start with the housekeeping, right? So, hey, reminder, we're off on this day. Hey, also, you need to complete your open enrollment by this date. Performance reviews are coming up, whatever it may be, right? And it's just a couple bullet points, but I have a list every single week that myself and other leaders in my department are adding to as we remember, oh, this is a company update. So that one-to-one communication where I already have everyone's eyes and ears is definitely a value add for sure.
Yeah, there's a tool that I know carries a different name in different organizations, but there's something that we use and often refer to at Jarrard. It's called like a no share do. It may ring a bell to some of you, but it's really a tool for leaders for exactly that, Maddy. It's sort of developed at the administrative level, but it's what leaders need to know, what they need to share with their teams, and what they need to do, right? Or what is the call to action for their employees. It's a really easy, efficient way for leaders to keep track of exactly those things, what they need to be reinforcing with their teams to make sure that they get and receive the communication.
I'm gonna have to look into that tool. That sounds like a much better way of handling my handwritten desk notes that I have every week. So
Post it still, but yes, that is, I think we've seen a lot of success with that.
I love that. The one other thing I wanted to mention in terms of how to reach those employees that aren't deskless or that are deskless. One thing that we've seen a lot of our communicators start working on are QR codes. Everyone after COVID, everything was QR code. If you wanted to see a menu right at a restaurant, it's QR code now. So don't be afraid to use QR codes to have it link back to your SharePoint or wherever that piece of content originates. Throw those up on your digital signage. You can print them off in those printed bulletin board notes as well, as James mentioned. The use of QR codes is really increasing, and its functionality people are so used to using nowadays, and very quick and easy. And there are plenty of free QR code generation platforms. So use that as well. All right. That was a great tangent. I liked it a lot. I know we are getting closer on time today, so I'm going to kind of skip through this. I think we talked about, clear channels, understanding the right methods, personalizing that content, something that's important for every employee and the communicators themselves. We are living in a day and age where literally every interaction we have is personalized. It is using AI, machine learning. So why stop at the doorstep of an employee's first day at work, or at every interaction? If Netflix, Spotify, Amazon can personalize my experience for me, why can't my employer with their communications? We talked about the human connection and then the elevated experience around strategic communicating and ensuring the greater level of trust and collaboration. So we'll jump into that future of communications when it comes to your day-to-day job. Something that James and I were talking about before was the massive shift that happened when healthcare organizations started using Epic. It was crazy, right, James? And having every healthcare organization go from pen to paper to a system that required that digital transformation. That was a really interesting time to be in the healthcare space and to see the level of increased productivity when we start utilizing the tools that we have at our fingertips. So I always thought that was interesting. But this dives into that AI-driven engagement. I mentioned Netflix, Spotify, literally everything you guys do is personalized, ensuring that you are capitalizing on those tools, not afraid to use those tools, but understanding what that means for your internal security systems. One thing I always say is don't ever just throw a company-wide message in Chat GPT. Make sure that you're communicating with your security team, understanding how can you use those tools effectively and efficiently, and make you the most productive while keeping your company organization safe. From the enhanced mobile communication side of things, you guys do have a mobile application or are looking to include one, I know Teams now also allows for that mobile dissemination. Being able to include things like push notifications, how do you enable those types of pieces of functionality across all of your users? So working with your technical team to ensure that those pieces are toggled on and off based on your internal structure. And then integrating comms platforms. We talked about ensuring that all those channels work together and you're unifying that communication system across the board. So diving into what does your tech stack look like and how can you capitalize on that? And that will require you working with your HR team to understand your people data. That will require you working with your IT team to say, hey, what other tools do we have out there? 9 times out of 10, we will work with a customer who comes to us and says, hey, I didn't even know we had this thing. How can this work within our Cerkl Cerkl sphere, right? How can we make sure we're capitalizing on those channels, those opportunities from the tech stack perspective? So don't shy away from those conversations, but you need to be collaborating with other departments, divisions to understand what's possible for you. Anything you'd add here, James?
I think, overall, it's having the technology is part of it. The other part of it is having the right content, right? So these two things go hand in glove. And so you can have the best technology, but if it's not the right content or if it's not customized, the technology is not going to work. And on the flip side, right, you can have the greatest content, but if you don't have, a sophisticated platform to push the content through, who's going to read it? So at the end of the day, it's really, I think the organizations that are best positioned are really those that are thinking about not only the content communications, but also the technology component of it as well.
Yeah, absolutely. And then as we continue to prepare for the future, making sure that you have that continuous learning and adaptation. So keeping up with trends, understanding what's happening. This whole AI trend, it was at first, everyone was afraid of it. Now everyone's starting to adopt it. And it's actually being utilized across the board. If you Google something right now, you'll see a little like blue box that's saying, hey, this is AI generated answer for you. So we're now becoming more engaged with those types of tools. So how can you stay ahead of the curve, understand what things are happening in the tech space, and get ahead of those scenarios internally? We talked about feedback and improvement. So understanding that the frequent data that's coming through from not only open rates, engagement such as that, but those pulse surveys and being able to address those and make improvements, be open, honest, transparent about how you're tackling those things. And then strategic planning, investment in technology. Everybody loves strategic planning times of the year, preparing your budget, but really thinking, how can we optimize the tools, one, that we have, and what tools do we have at our disposal, and how can we invest in other tools that will help optimize what we might be missing today. So there's lots of investment opportunities there, but it's understanding what you all need, what you might be missing, and what's hiding behind the curtain as well. Anything else I missed there, James?
No, I think the one that I would add that's not here is sometimes you have to slow down and speed up. And what I mean by that is, meet with different sort of employee groups, take an inventory of what they're wanting, what they're needing, what technology they're open to. Put some focus groups together, send out a pulse survey, use a tool like Menti or SurveyMonkey, right? Get a sense of what the environment is and their readiness for certain things before you develop, and let that inform your strategy and then your investment. And then you can go much faster because now you have a greater sense of what really is going to stick. And that's the key. So what, works for one organization may not work for another. Some organizations are very mobile friendly and employees love being able to receive messages and have an app on their phone. Others, not so much. But I think you don't know that unless you actually ask and slow down and really understand sort of what the culture is and what they're ready for.
Yeah, that reminds me that we see some of the most successful launches or implementations of our software when we're working with the project management team or the communications team that has a group of stakeholders that are not communicators that are assisting with the implementation. Because as you roll out a new tool, of course, the communicator needs it to do X, Y, Z, but they're not necessarily understanding what does the end result, the end user, the actual employee receiving the communication want from this. So those are some really fun conversations to hear those stakeholders say, hey, actually, we prefer it on the go, the communications on the go. Okay, great. So how do you make sure that your communications are mobile friendly, responsive, right? That's the worst thing in the world when you open an email on your mobile device and it's all wonky because you can't read it, right? Text is too small. So thinking through those things, understanding what those main stakeholders can provide to help leverage a new opportunity, like adopting a new software. Don't just make it a siloed decision as to how those things should work together, how they should be configured, and how they should be used. I love that, James. That's great. Well, I know we are almost up at time. We want to, again, thank everyone for joining us and open it up for any discussions or questions. I think we've answered a couple of those so far. Let's see, any other questions that we might have coming through? Let's see, from how can we ensure employees are seeing important communications? I'll just quickly jump into that one as well. Hopefully there are some ways in which you can pass that message down to the managers, the people managers, things of that nature as well. But look for ways in which your existing tools might be able to allow you to, let's say, retarget that communications to say, hey, I know I sent out this comms. I want to resend this exact same comms to everyone who didn't open it. So you're not inundating people with things that they've already seen or already engaged with. Also being able to include things such as acknowledgement, right? Where they were required to click a button to say, I acknowledge this happening. And then being sure to send on a cadence for those who haven't acknowledged them. Obviously, those can be tool specific, but there are lots of ways in which you can take that type of methodology and apply it if you're just using Outlook for a communication tool today. We have another one.
Another question here, Maddy, as a healthcare communicator, how can I increase buy-in from leadership with new technology?
I love this one.
Take this one first.
Okay. This is my favorite. Let's be honest, like it's not necessarily easy, but it's being able to show the ROI. If you take all the stats that we just mentioned here today, that your turnover is 20.7%, that's insane. If you as a communicator can contribute to reducing that even by let's say 5 percentage points, think about what that does to the ROI of the business. That is saving your organization hundreds, if not millions of dollars. So kind of removing yourself from like, oh, I want this thing, but thinking about it from a business perspective of what can this do in terms of, revenue to the company? What is the end result there? Those are some of my favorite conversations. James?
Yeah, I was going to say something very similar. I think you gotta connect, the communications element of it with sort of your other strategic priorities, right? Your retention, your recruitment, your, how you're communicating with HR. So I think when we've seen sort of leadership buy-in at the executive level, it's because they see that communications also advances other strategic priorities that the organization has.
Exactly. We'd love to, I'm sure James and I would both, whoever asked that question, I love digging into specific use cases and kind of giving you perspective as to how we might have seen other customers like you articulate that out to leadership. So feel free to ping us on the side. I know James and I are problem solvers, have been in this space for a long time and would love to share our additional knowledge. Awesome. James, any other closing notes today? It's been an engaging hour.
Yeah, I loved all the questions. They were spot on. I think you were all thinking about it the right way. Just appreciate the time, and hopefully this is the start of many more conversations.
Absolutely. Thank you, James. So much fun. Appreciate everyone attending.
Bye, everyone.